Russ, you have a distributed workforce across hundreds of provider settings. How are you thinking of using cognitive agents to support that workforce and relieve them of the burdens that they face?
It's a great question, David. So we have about 2,000 anesthesiologists and nurse anesthetists in over 250 locations, hospitals and ambulatory surgical centers. And you have to realize they're not in an office, they're not sitting at a desk with a computer, they're in an operating room providing anesthesia services. So how do we contact them? How do we work with them administratively? So off hours is when they have more time, and that's when our offices are closed, but we have skeletal staff. So if someone wants to reset a password because they're trying to finish their clinical medical education, or they're trying to just check their emails, or they want benefit information about the physician's own benefit. What's their PTO time? What's their health benefits? If open enrollment changes things, how do they contact HR when they're in the operating room all day long? There's also a very complex process for managing credentialing. So providers need to have their advanced and basic cardiac life support training renewed every few years. And it's a lot of paperwork. It's emails and faxes going back and forth. It'd be much simpler if they could call 24 hours a day, whenever they have time, when they're not in the operating room, and ask all these questions. Have passwords reset. A chairman or chief of a department wants to disable a password, they can disable a password 24/7. They could even have that information go to our customer is the hospital, right? So they can have that information in an email, go to the hospital to alert them that someone left the organization, their password's been disabled. The hospital now needs to disable the password as well. So there's a huge compliance process that can be solved by this that is also obviously involved with HIPAA. So that's just the administrative side of it. And there are many things we can do on the patient side. So we have a pre-surgical testing portal that patients go on. We're rolling out in July. Patients can go on, answer questions about their health, so our anesthesiologists can prepare properly for their procedure. How much more interesting would it be if they could call Amelia and have a dialogue and have a conversation about their health? Again, 24/7, and have that information passed to the anesthesiologist. Then there's the part of the post-procedure, pain management, outcome management. Have Amelia 24/7 talk to our patients about pain management or their outcomes, get that information to the right practitioner and at the right time. So there's so many things we can do, even interoperatively. You know, there are standards that anesthesiologists follow if someone has a cardiac arrest in the operating room or a pulmonary event. There are procedures they can follow. They could talk to Amelia, someone who may be doing, let's say, endoscopy, endoscopic procedures or colonoscopies routinely, and now they have someone with a heart attack. They didn't know what to do, but you want to make sure you don't miss any steps. Amelia will have all the information. And then finally, this repository of data, this adds value to the net worth of a company. You no longer rely on corporate information being tribal. You no longer rely on individual experts because there may be surgeons who are more anesthesiologists more specialized than others. You can capture all that information, whether it's administrative information about benefits and credentialing, whether it's clinical information. That becomes a rich repository that never leaves the company, regardless of the turnover you may have in your staff.
Thanks a lot. And Greg, knowing Health Catalyst and the mission there at Catalyst being around continuous quality improvement, quality is often about doing the routine